All right, we're here today with Joe, and Joe is about to start his treatment with Dr. Davis. So, Joe, tell me a little bit about those knees. How long have you been having problems with them?
I've been about 1 to 3 years, maybe. I've
Wow.
had 3 knee surgeries on this one and 2 on this one, but they're just so bad now, sore and stiff, and it's just very hard, difficult to walk.
Were they replacements on those knees?
No, I had an ACL replacement on this
Ooh.
one and just arthroscopic twice on both of them.
Right, right. So, and you've been back to the orthopedic. What did they tell you?
They kind of told me the next step was replacement on both of my knees, and I don't know if I was ready for that yet, so I was going to give this a try first.
Yeah, you're too young for that, right?
No.
Yes, you are. We don't talk like that here.
Okay.
All right, so you and I had discussed earlier about your discomfort level today, and you said you were about a...
7.
Okay.
Very painful to walk on flat surfaces, up and down stairs, and squatting or kneeling, anything like that.
Right, right. So, we're going to do a couple different exercises. We're going to see where you're at. When I have you do the exercise, I'm just going to have you indicate where it's hurting.
Okay.
And, and let me know if you're feeling it in your low back, if it's, if it's behind the knee, in front of the knee, inside, outside, just so we have a good idea of where to start working out. Okay? So, the first thing I'm going to have you do is I'm just going to have you stand up.
Okay, I always have to push myself up because it hurts so bad to do it.
And where did you feel that?
All back, the side and the back of this knee, same on this one.
Okay. All right. So when you go from that sitting position to that standing. Okay.
Yes.
I'm going to have you put your feet shoulder length apart, both arms out in front of you, and I'm going to have you squat down as far as you can.
Oh, you think so?
And I mean, if it's just a little bit, that's it. Right there.
Right there.
All right. Slowly come back up. Where'd you feel that?
All in the back.
All the way down.
All the way down.
Okay. All right. So the next thing I'm going to have you do, Joe, is if you could go up and down the stairs for me.
Okay. I always hold on because I'm always
I want
afraid
you to hold on.
They're going to give out on me. That's the other thing I'm afraid of, is it's just going to...
So almost feels like a weakness too when
Yes,
you're okay.
Absolutely.
All right. We're going to turn around and go back up the stairs. So, Joe, which was worse, going up the stairs or coming down?
Down.
Down the stairs was worse?
Yes.
And did you notice, was it when it was bending or when you were putting your weight on it?
Usually when you go and you put your weight on it.
Okay.
Going down.
All right. Now, out of all the 4 exercises we just did, which one caused you the most discomfort?
Actually getting up.
Going from sitting to standing. Wow. So what would an average day be like for you?
Miserable. Just dealing with pain all day long.
Because if you're at a 7 now,
Yeah.
what would it be like at the end of the day?
Very painful, and then go to bed and try to fall asleep with them very achy and pain.
Do you have a hard time falling asleep because of the pain?
Yes.
Wow. Well, you're at the right place, Joe.
I certainly hope so.
You ready to get
this thing
started?
going.
Let's do it.
Nice deep breath, and bring your knee out to the side, and kick, 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 kick. Good. Put this down. Nice deep breath, and go. 1, 2, kick, 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 kick. Take a nice deep breath and go. 2, 3, 4, and kick, 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 kick. Good. Let's switch. Okay, so let's move that way first. Just let me move. You can stay. Yeah.
Let your leg come across.
I want to get a stretch in this muscle. Okay, take a deep breath and just push into the instrument. Yep, that's good. 2, 3, 4, 5, 6, 7. Release it. Good. Okay, take a deep breath and press. 1, 2, 3, 4, 5, 6, 7. Release. Good. Nice deep breath and press. 1, 2, 3, 4, 5, 6, 7. Release. Good. And just hold it there. Down and out. 1, 2, 3, 4, 5, 6, 7. Good. Relax it. And take a nice deep breath and go down and out. 1, 2, toes out. 3, 4, 5, 6, 7. Relax it. Take a nice deep breath.
All right, we're back with Joe, and Joe has
Okay.
finished his procedure with Dr. Davis. So let's see what you got. Stand up for me. Hey, hardly even
Hey.
pushed off.
Hardly even pushed off.
All right, let's try that squat. Feet shoulder length apart, arms out in front. How low can you go?
About to there.
Okay. All right.
Okay.
Now let's do the stairs, Joe.
Okay. Force of habit just to hold on.
Yeah, well, I'd rather you hold on.
Okay. Then turn around.
Yep, and go on right on back up. All right. So, how you feeling,
All right.
Joe?
Better than when I first got here, for sure.
You were a 7 when we first started. What do you think you are now?
It's gone down a little. Still have, some pain. It's not all going to go away, but probably a 5,
Okay.
maybe.
All right. And we haven't even done therapies yet.
No.
All right. So, are you happy with today's visit?
Yes.
All right. Let's go get you on therapies and get you feeling even better.